How are you doing? This is my first ever talking to a conference. So this is my first time. Please don't pick on me. I'll try to talk slow. I get excited. It feels like running a waterfall right in front of me. And I'll have some kayaking pictures too. So I'm going to talk about LDA with Morgellons. This is one patient I have treated with LDA. That's a low-dose antigen injection. You will hear LDA for Lyme. You will see a lot of things about that on the internet. But I did not use this on this patient. I only used a standard LDA. Okay, my experience with Morgellons, I was introduced at the ILAD's booth. I think Ginger and Cindy was there. I said, I have not seen a Morgellons patient. And I says, I don't know anything. The following week, I have a patient who came to my office, says, I have Morgellons! Surprise! Yes, I heard, and I actually kept the brochure. So I had Ginger's email, so I actually emailed her, and she gave me some help, and that's where my start. Then, 2 years later, I went to ILADS. They actually offered some Morgellons class, and I took several classes. And guess what? A week later, another new patient. But she said, I have a rash. So that's me about a month ago. Snow, kayaking, all my fun. That's the reason I live in West Virginia. Okay, so the case is I have a 67-year-old female with 3 years of rash. She was diagnosed as leg-extended dermatitis. I have no idea what they are. She was on steroid, and she actually had no improvement. She told me, I think this has come from food allergies. And guess what Cindy gave me? That little microscope. And guess what I saw? And I says, oh. I told her, I think this is Morgellons disease. The standard, I think the new treatment will be doing antibiotics and antiparasitic medicine. But she says, I want to be treated for food allergies. So I said, sure, why not? So with her, we actually got get the blood work for food allergies. I started her on a gluten-free diet. I actually sent Lyme testing for IGeneX. She was 67 years old. She has Medicare, so Medicare pays for IGeneX testing. And I gave her a shot of LDA, LX, IC, and Chem. We will go over those stuff a little later. It's a small shot. It looks like this. It's under your skin. It burns. Some people get a reaction. Their arm will swell up. I actually get the worst reaction in my whole patients. My left arm will swell up for like a couple days. It itches. I tell them to ignore it. Don't scratch it. Don't take Benadryl. It'll screw up everything. And this is what the LDA looks like. This comes from a compounding pharmacy, and you have to order it specially. And there will be doctors who does this all over the country. So a month later, I get the results back from IGeneX. And I don't think anybody showed you guys a lab that we get back. This is what it looks like currently. And her IFA was negative. This is an IgM. That was very negative. I see a little band on 41. I'm not sure where to go with this one. Same as IgG. She has nothing but a little band on 41, which I'm not sure where to go with this test with Lyme disease, with Morgellons with her. Her food allergy comes back high with dairy, and very high on yeast, and high on sugar. So I told her, guess what your diet is? Gluten-free, dairy-free, and yeast-free and sugar-free. Now, I gave her the first shot. Remember, I told you guys, I didn't believe this is going to work. She comes back 2 months later. I don't have her first set of pictures because I didn't think it was going to work. She comes back, she says she is 75% better, and she was a happy camper. I told her I was going to do all the crazy things, and I don't get to do it. So I decided to increase her food allergies a little higher to call MX, and IC, and Chem. And Gave her a shot. I told her, come back in 2 months. LDA we use every 2 months. And this is the same arm, same place, on my iPhone. She's very happy. She continued to improve, and I gave her another set of shots. And I do not have, well, 2 more months later, so I'll see her back in June. That's me. This is what I do. I get to travel all over the place. Okay, so we're going to talk about what LDA. LDA is extreme low dose treatment that uses a broad-based mixture of allergens. We use inhalants, foods, chemicals, bacteria, food that is immunologically activated by an enzyme called beta-glucanase. The LDA works by presenting a very precise low dose of a substance made detectable by beta-glucanase to the dendritic cells in the skin, signaling lymph nodes to produce specific T regulator cells. And the T regulator cells addresses the inappropriate reactions like allergies to calm down. Now, this is a list that we use that we say this works. We have used almost all of these LDAs from one of my patients. These are other things that works. And the components of LDA. There are 2 things we have to use in the syringe. It's the beta-glucanase, it's 0.01 cc, and various allergens with 0.04 cc. It's a very, very small dose. We have to use a special BD needles to do the injections. And there's various antigens. So we explained the LX. That's the first one I used for her with the food allergy. That's foods, low dose, and additives. The second time I bump her dose up to MX, and that has medium dose foods and inhalants. IC is environmental allergies, and chemical is the chemical allergies. They also have other things for Proteus, Klebsiella, bactericidal, streptococcus, and Yersinia. I have not used that on this patient. And the new LDA we have that was developed by Ty Vincent that has Lyme, yeast, mycobacterium. We also use sometimes the joint aspiration, stool. It's sterilized, don't worry. Same as sarin. Skin scraping, which I am hoping to do one day on one of my Morgellons patients to get more. Biopsies. Now, the overall success rate is 70 to 75% for what we showed earlier. This is looking for food allergy, chemical sensitivities, environmental allergies. Okay, the good thing is the treatment's every 2 weeks. It's ideal for patients with multiple problems. It covers inhalant, food allergy, chemicals, and autoimmune disease. It's the best immunotherapy for chemical sensitivity. I think that's the only one I can actually think about. Only immune therapy for anaphylaxis, and it's safe and effective treatment for kids and babies, except the painful portion. I have to fight my son every time I do the shot. If you want to learn more about it, there's a group called AAEM, American Academy of Environmental Medicine. They offer a conference every year. They have a 1-day workshop for that, and that's how I learned for it. You can look for patients looking for this. This is the Dr. Schrader's website, or just Google Dr. Schrader with LDA, and his website will pop up first, and there's a list of physicians. Now, I use on this patient only standard LDA. I did not do the Lyme LDA. There's a little difference between that because when we order from a standard compounding pharmacy, we get the standard LDA. If we want to do the Lyme LDA, you have to go get that from Dr. Vincent, Ty Vincent from Hawaii now. And not every doctor you see on the list there on the Dr. Schrader's website will do what we call the immunotherapy LDA, which is a Lyme. Now I'm trying to get my son to enjoy kayaking now. He is 11 years old. And the review is, as I told you guys, I only did food, inhalants, and chemical. I did not do any Lyme antigen right now on her. Would I do it in the future? Maybe. She is about 80% better right now. So I'm looking for more guinea pigs, more patients, because I want to try this and see if it improves. Good thing is it's a shot every 2 months. There is no worry about antibiotics with the gut issue. And the worst thing that will happen to you is you will be the same place 6 months later, a little poorer because you spent some money. And the good thing is there's a lot of physicians in this country who does LDA. And there's one here in Austin. I'm sure you can easily find somebody. And it may be worth a try.